Dr. Fauci, the cavalry's coming. We're all excited. We can't wait. We've worked very hard for this. And the first doses of the Pfizer COVID-19 vaccine are set to arrive in the state as early as December 16th. Initially, Oklahoma expects to receive about 33,000 doses of the Pfizer vaccine. Moderna vaccine is expected to come shortly after, probably around December 22nd. We'll confirm this date once we receive further information. We believe that Oklahoma could receive up to 60,000 doses of Moderna once it's approved through the EUA process. This is part of the solution, but it's not the only solution we need to implement. Remember that distributing this vaccine takes time. It will start with limited quantities. However, we are expecting 166,000 doses in the month of December. And, but that is just the first round for that 166,000 people. They have to have a second shot approximately 3 weeks after the first one. And we need to keep everyone doing the right thing to keep our numbers low until then. It's vital that we take precautions to slow the spread, and everyone should continue to wear a mask, wash their hands, watch their distance. And again, we added and wait for the vaccine as our fourth one yesterday, which I'm happy to be doing. These actions, though, in conjunction with the vaccine plan, can make a huge difference in keeping our families and communities safe and healthy in the long term. We urge you to work together now to protect one another from COVID-19 so we can be together soon. Please be safe through the holidays.
Main thing, just look down the side.
All right, I'm going to turn it over to Keith Reed at this time.
All right, good morning. I want to remind everybody that we do have a CDC approved plan and are ready to implement distribution of the COVID-19 vaccine to our priority groups. This plan was built with subject matter experts in their respective fields, such as public health experts, medical professionals, epidemiologists, and others. Keep in mind that the vaccine distribution plan has to be very fluid, as there are many unknowns that lie ahead. And we're going to plan to work through those as they present themselves.
Sorry, Kim, can you mute? Thank you. Everybody, please mute. Thank you.
OSDH will continue to work with our federal government partners to distribute this vaccine. And I want to point out that the federal government's role is to regulate vaccine development, approve those that are safe and effective, as we've seen over the past couple of days, and work with vaccine manufacturers to procure vaccines and determine how many we receive and when. Oklahoma and OSDH's role is to work with hospitals, clinics, pharmacies, tribal health, and local public health entities to ensure that we get the vaccine out all across the state. The state will largely rely upon the federal tracking and reporting systems built specifically for COVID vaccine, and will work with federal liaisons at CDC and Operation Warp Speed to determine how best to report state vaccine data. The OSIS system, our Oklahoma State Immunization Information System, will be the primary system used to track individual vaccinations, to include the first and second doses for those that are required. Please note that this does not mean that the general public will be able to access the vaccine during the initial rollout. Our most at-risk populations that will be on the front lines are included in the first phase of our vaccine distribution plan. Groups such as healthcare workers, long-term care facility staff members and residents, and public health staff on the front lines will be the first to receive the vaccination. Priority groups and populations are divided out by the 4 phases outlined in our vaccine distribution plan. So to review those, during phase 1, our groups are long-term care residents and staff, healthcare workers providing direct inpatient COVID-19 care, public health staff conducting frontline COVID-19 pandemic mitigation, Oklahoma State licensed emergency medical technicians and paramedics. As we move into phase 2, we'll pick up first responders, and that is paid and unpaid, as we know that there are many that serve in a voluntary capacity. Healthcare workers providing direct COVID-19 outpatient care and services. adults age 65 and older, and adults of any age with the comorbidities, public health staff, and others key in supporting frontline efforts in this response. Phase 3, we will bring on teachers, students, residents, and administrative staff in education. Also, we will include critical infrastructure personnel, and those are the ones specified in the 3rd executive order from the governor. Phase 4 will be open to all Oklahoma residents. We anticipate the general public will have access to the vaccine throughout 2021. With that, I'll turn it over to Dr. Drevets.
Good morning. It's great to be with you. The really great news about these vaccines, not only is that they're coming to Oklahoma, but that they're also safe and effective. The US FDA has a very rigorous scientific and regulatory process that these vaccines have gone through or are still going through, actually, and it is designed to assure the public that they are safe and indeed effective. We're really talking about the Pfizer product and the Moderna product because those are the first 2 that will come to Oklahoma. Both of these products are highly effective in the 94 to 95% effectiveness range. And in terms of vaccine efficacy, this is just remarkable. Just few vaccines are better than this, and many are not this good. So Oklahomans should feel very confident when they receive the vaccine that they will become protected against infection. The other thing that everybody needs to know is that side effects do happen. We've all had vaccines. We've all had some kind of a side effect from this. And with both the Pfizer product and the Moderna product, these will happen. According to the manufacturers, a lot of people have pain after the injection site or at the injection site. And again, this is typical. People can have shivering, some fatigue and malaise. Some people will have fever. But both of these vaccines have very few serious side effects so bad that you might have to take a day off from work or change what you're doing. And I think everybody in the state needs to understand that these products are useful, they're going to be available, and they will help us turn the tide on this pandemic.
Thank you, Dr. Drevets. Do you mind sharing your title?
So I'm the Chief of Infectious Diseases at OU Health and a professor of medicine at OU College of Medicine.
Thank you. We'll go ahead and open up to some questions. I know we have a few in the chat already. Barbara, do you want to go ahead?
Yes, thank you, Anthony. I appreciate it. It looks like you have added another category to this plan that wasn't in a previous handout. You've got adults 65 and older and adults of any age with any comorbidities. Can you tell me why that category was added and how you expect that to work? For example, somebody that is a chronic smoker versus somebody that has got diabetes by no fault of their own.
Keith, I'll let you field that one.
Okay. So I'm having a little bit of connection problem, and I think I missed the very first part of it. But if I understand your question, you're asking about why we added those with comorbidities on the 65 and older category. Is that correct?
That is correct.
Okay. So we've seen throughout the response, throughout the pandemic, that comorbidities certainly increase an individual's risk to having a poor outcome from COVID-19. And because that category was pretty broad and doesn't fit into a specific age group or anything like that, we wanted to provide an opportunity for the primary care physicians around the state to help get their members or their clients and patients that are meeting these criteria, that maybe are diabetic, have heart disease or some other condition, We want them to have the ability to get them in and get vaccinated, along with those that are at great risk of the 65 and over. So we will work with primary care physicians around the state to help identify those individuals that meet that criteria.
I think it's also a recognition that age is not the only risk factor. It is a powerful risk factor, but there are many other risk factors that go into what gives somebody a bad outcome with this infection. So I think we're really trying to recognize the breadth and the real nature of this disease also.
All right, we'll move on. Chris, Cassandra with K4, are you on?
Yeah, there are a number of companies already and industries that are vying for their workers to be considered, quote, essential workers, hoping to get, the vaccine as early as possible. And I'm wondering what kind of leeway is there to even make a decision like this? I mean, are these efforts worthwhile? And then also, who will make those decisions and how will those decisions be made?
It's a good question. I'm happy to answer that one. So we don't decide who's an essential personnel or not. That's done at the basically the level of the governor's office. So there are, if you look at essential personnel, there are some states that follow the federal guidelines, and there are some states that have designated their own guidelines. Our state has followed the federal guidelines. So if they are designated as an essential personnel from the federal level, Oklahoma has whenever they develop their guidelines for essential personnel, they just followed that one. So the process on how to do that, I couldn't really help you very much with. That would be that would have to come through the governor's office, and they would have to add something to that or change what they're doing throughout the state. Everybody, we want to vaccinate everybody in Oklahoma. So eventually everyone will get the vaccine. We're trying to get the people that are at highest risk initially. So the people that are working in the front lines of the pandemic response, because they are absolutely necessary to continue this fight. And they're also at risk by doing what they're doing. So we want to get them first, but then we're going to go straight to long-term care facilities, because we know those individuals are some of our highest risk population, and then move into the additional layers of need until we get everyone done.
Ken Miller, AP.
Good morning, and thank you very much. Dr. Frye or Dr. Drevets or Mr. Reed, why the change at all? Is the state going to be getting more of the vaccine than originally anticipated? I believe 33,000 doses from Pfizer was mentioned about a week ago, and now it's 160 some odd thousand that was discussed yesterday in the news conference with the governor.
Yes, so we are getting more vaccine than we anticipated. It is coming in at a larger numbers as far as the follow-up shipments are coming in. We're getting more than we anticipated on that. And that actually, I think, is a conservative estimate. They told us 166,000, but there's actually there's also another shipment from Pfizer that they haven't given us the exact number yet. That's we've got a holding spot for. We know it's coming. We just don't know how much is in there. So that number will probably go up from 166,000. And we're really not making much change. That the phases that the people that are in these phases, these different groups, we had an independent board of experts that decided who were going to be in these different phases. And they did a lot of hard work on it. They did a great job. Of course, the plan is fluid and does change some as we move through and change our environment. We didn't even know which medication or which vaccine we were going to get first and how much we would get. And everything when they were putting this together. So we're just going to work through our most vulnerable populations first and move on.
All right, Janelle with CNHI.
Yeah, I have two really quick questions. The first question I have is the 166,000 doses you're expecting, does that account only for Pfizer's doses, or does that also include Moderna's that are when it gets the emergency approval?
That includes both. Keith, do you have those numbers you can run through with everybody? Keith may be having some.
Keith's having problems with his connectivity, but we can get a breakdown of those numbers and get them in the chat or following this if needed.
Yeah, we have a breakdown of what's expected when it's arriving. We're happy to give to everyone, but that includes both.
Great. Just one other quick question. In your updated vaccination priority list, you list a lot of the long-term care staff and residents is included as part of the state vaccination plan. How many non-CMS facilities have to be served by the state, and about how many individuals does that represent?
I'm unsure of the exact number of individuals, but I think there are only about 6 non-CMS facilities in the state of Oklahoma. So we'll take care of those. That's not an issue at all. And then, of course, as you've heard before, CVS and Walgreens are contracted with the federal government to help with the other CMS long-term care facilities.
Okay, thank you.
Okay, Chris Polanski.
Thank you, Anthony. Good morning, everybody. Obviously, building public confidence in the vaccine is important. We're hearing from other states and around the country, figures like past presidents and health officials and governors, getting the vaccine on camera to kind of inspire confidence and encourage uptake of the vaccine. Is there anything planned for Oklahoma like that? Commissioner Frye, will you get it on TV? Will the governor?
Oh, I'd be happy to get on TV and get it. I don't have any problem with that. I don't want to be jumping in front of the line in front of people that actually need it worse than I do, but I would be happy to do that. And I know Jackie Shawnee is head of our communications, and she has some things planned.
Okay.
Sorry, I can confirm we are working on that. I think that will be an important piece, but as Dr. Frye mentioned, we certainly don't want to put anyone out there that would jump the line. We really want to stick to kind of our phased distribution, but yeah, I think you're right, that's important.
Thank you.
All right, Allison, KOSU.
Hi, I am just wondering, tribes are developing their own plans along with Indian Health Service. I wanted to know, how is the state and the 39 federally recognized tribes working together, if they are at all? And then I have a second question, which is about refrigeration units. I know that those are in really high demand, and I wanted to know if the state has enough to store all of the vaccine that they're going to get.
We definitely have enough storage facilities. We've had several strategically placed around different regions, and we actually had 11 units donated to us from a foundation in order to place it at each one of the regions throughout the state, as far as our public health regions that we have. So we have plenty of storage. I think its plan's going to come together very well with that. And we have been working with the tribes. They've been great partners through this whole entire process. From testing on through the whole pandemic, I know they opened up their swab pods and tested people whether they were tribal members or not. They were very helpful through the process, and they've been helpful in this as well. We've been meeting with IHS and helping coordinate, making sure we have a coordinated effort throughout the state.
Okay. Allison, did you get your first question answered?
Yeah, I mean, well, you said that you've been working with IHS. I know that the tribes are the IHS is receiving their own shipment of vaccines, and that doesn't necessarily, that 166,000 number, that doesn't include the vaccine that the tribes are going to get, correct?
Yes, I think that's correct. They're getting their own direct distribution. That's what's coming to us. Some of what we have is shared. So in other words, for instance, long-term care facilities, part of the doses that we have, we're going to be supplying to Walgreens and CVS for them to do the long-term care. So even though we're partnered with some people, some of the supply that we get is shared for that. But the federal agencies like the VA, the tribes, et cetera, are receiving their own allocations as well.
Okay, thank you.
Rick, Fox 23.
Yes, I've got two, and one actually piggybacks off of Allison. When we talk about these freezers, are there going to be some in every corner of the state, or are some communities going to have to be more reliant on Moderna because it is easier to handle?
Yeah, there's no question that the Moderna is easier to handle, and we will certainly take that into consideration on which vaccine we're sending where, because even though we do have these ultra cold storage facilities in all of the 11 healthcare districts that we have, that logistically it's just more difficult. It's once you open it, it has a limited amount of time to use it, and it comes in, there's about 1,000 doses in each one of those boxes. So you have to be prepared and ready to use them when you do. So the Moderna just simply is going to be easier to use in more rural areas.
My second question is kind of very similar to distribution as well. I know Walgreens and CVS are stepping up to the plate, and the general public is set to get theirs in phase 4. Are we saying that in all phases everyone's going to show up at Walgreens and CVS, or is it just in phase 4 when people will start to be pointed to those two pharmacy chains?
So we are the phases. I know everybody wants to know, when they're going to get it and how who's first and who's second and all that. But the phases really don't have any big walls in between them. If we have 1,000 doses, next week at one of the healthcare centers, and they only have 700 employees there that are frontline workers, we're going to use the other 300, on whoever's there, whether they're in that phase 1 or not. So, and some of these will potentially run basically run at the same time. For instance, our prison systems, our Department of Corrections, we will send them the vaccine, and they have their own medical system in order to give that vaccine to whoever they need to give it to. So that's simply us supplying it to them. It's not our use of personnel and everything else that we need to get this done. So we can immediately, while they're doing that, be, for instance, using it for, I think teachers are right there in that next category. So we could be doing teachers at the same time that they're doing the Department of Corrections. So I realize there's a phased approach. We need to do that to keep us organized and concentrate on what we're doing, but there really are gray lines between those. And CVS and Walgreens are going to be doing the long-term people initially. If they are able to help out, which I hope they do throughout the entire immunization period, that's great. I'm happy for them to give the vaccine to anyone that they can.
Thank you.
Also just flagging the breakdown of the vaccines is in the chat of the 166,000. So we'll keep moving. Paul?
Yes, thank you. Just wanted to check on maybe probably Dr. Drevets this question, but about students. The safety trials for the Pfizer vaccine looks like they were just for folks 16 and over. Do we have any more data or any more information about the use of safety or vaccines for children under 16, considering that they're going to be in phase 3 according to the state's plan?
Right, so Pfizer is conducting additional studies in the age group 12 to 16. I think those are ongoing and they're starting enrollment in that now. You know, the critical thing to remember that, you know, in the 16 to 18 age group, immunologically, there's not a lot of difference between 17, 18, 19, 20 per se. You know, the best way I heard it explained is that the age at which you can vote doesn't really correspond with immunology. And so there's no reason to believe that they will not also be protected, or younger individuals are not also protected by this vaccine. The Pfizer phase 3 studies did show that the younger you were, the more noticeable your side effects and reactions were. So individuals in the younger group had more, say, pain, redness, swelling than did older individuals. So I would expect that to hold up in there, but in these newer studies, but I still don't think that would be a reason to not get the vaccine.
Thank you.
Erika, News 9.
Hey there, thanks. So with all the vaccine talk, when do you see Oklahoma gaining what we've talked about, herd immunity, if many won't have access to the vaccine until sometime in 2021? Is there a kind of a timeline you hope to see Oklahoma getting on to being back to somewhat pre-COVID life?
So those are several different questions, and let me deal with herd immunity first. Herd immunity is a concept that epidemiologists use to express when a particular germ, in this case a virus, has a hard enough time finding the next person to infect that the infection rates start dropping. So that's considered herd immunity, and it's generally in the somewhere in the 70 to 80% range of individuals that need to be immune, and that varies with different infections. The other thing you really need to express to your readers about herd immunity is that it's a good thing, but it's not great. For example, you know, before vaccines, all we had was natural immunity and herd immunity in populations, but that didn't prevent smallpox from continuing to infect people. It didn't prevent polio outbreaks. And even now, it doesn't prevent tuberculosis in countries where you have a lot of tuberculosis. So herd immunity is good, but it's not great. So your next question is sort of when can we hope to see a real drop in the numbers of new infections? So that's a great question, and this is my opinion, and we'll see if it's right or not. You know, the virus is going to continue to infect people for the next several months. And so we are building up a group of individuals in our population that are indeed immune and will not be infected again for a particular period of time. We are rolling out the vaccine. And so then you're also protecting individuals, thousands of individuals, from getting infected. And then lastly, we're still hopeful that this coronavirus will show some degree of seasonality like other coronaviruses do, and that sort of in the late winter, early spring, when the weather changes, it becomes warmer and more humid, that this virus will become less fit in the environment and less capable to infect others. And so I'm hopeful that end of February into March, we'll see really serious drops in the numbers of new infections, and maybe it'll even happen before then. And I'm hopeful that that trend will continue throughout the spring as we continue to roll out vaccinations. And I'm hopeful that we can all look forward to a great summer. We do need to continue to be vigilant, and we will need to continue and finish the vaccination program, because we really don't want to see a resurgence of this infection then in the fall, which again would be its biological time to come back. Saxum, you're muted.
Sorry, Trina, KOCO.
My questions have been answered. Thank you.
Okay. Michael Smith.
Thank you. I actually had kind of two questions. I'll start with the first, perhaps the easiest one. While developing the vaccination plan here in Oklahoma, what kind of consideration was given to the families of long-term care facility employees or the families of healthcare workers? And then second, can you just kind of describe how the vaccine will actually be logistically distributed throughout the state? Will it be going through the regions? Will it be going directly to these facilities? How will the distribution work?
Sure. It was really very complex. You know, this plan was not a simple plan to put together, and the logistics of it is incredibly detailed and difficult. But so the answer to your first question was, did we look at, for instance, families of someone who is at risk, and did we think about vaccinating them at the same time? All those things were discussed, but it becomes too complex. Even as it is, it's very complex. So we're dealing with the people that actually are the ones that were more concerned about getting sick and not their families initially. But of course, they will be included in the overall people who receive vaccinations. The second part is the shipments will go directly to certain designated areas, and then we're using a kind of a hub and spoke model where we are, those are distribution centers that we will be moving it to the other regions from there.
Thank you.
Tiffany.
Hi, thanks guys for taking our questions today and for all the information. Just checking to see with you, so can you explain a little bit about the distribution you were answering earlier? So of the 33,000 that we're getting the soonest from Pfizer, not the ones coming in on the 23rd and after, what percentage of those will be going to, like you were mentioning, Dr. Frye, to CVS and to some of the other the people that you're sharing with? What numbers, like what will that breakdown of that first 33,000 be in terms of healthcare workers, what's going to CVS, and what you guys are distributing to Oklahoma County Health Department and Tulsa Health Department, that type of thing?
I was muted. Hang on. We'll have to get you all that information. I mean, it's detailed, and they do have the exact numbers that they're shipping to different places. And so we can get you the numbers that are going to different regions, but I don't have that with me right now.
Okay, no, that would be great. And then also, I just wondered if you could, I'm not sure who the question would be for, but I wondered if you could explain a little bit. You said, I heard you guys say that throughout 2021, in terms of like for all of the phases throughout 2021. So I know before we had said the hope was to have everybody vaccinated by the end of the spring, potentially into the summer. Is that changing now? Are we thinking now it may take longer throughout the year, or was I misunderstanding?
No, I mean it's really dependent.
I'm sorry, Commissioner, this is Keith. I was able to get back on.
Okay, great.
To offer to help. Yeah, I was going to let me go back to your first question and give you a response on that. So the initial 33,000 doses that are coming in, those in particular are not, those are going straight to frontline healthcare workers that are directly taking care of COVID patients. And we're using a hub and spoke model to get those distributed into some of our significant size facilities around the state. And then following shipments, we will get into another echelon of those hospitals to make sure that we get good coverage to hospitals around the state. Now, on the second shipment of Pfizer we get, which we're anticipating around 38,000 doses, we're going to divert about 27,000 doses of that to the CVS Walgreens long-term care pharmacy program so that they can get into those long-term care centers and start vaccinating the staff and residents of that. This is a great opportunity for us to leverage them as a resource so that we can maximize access to the vaccine in the shortest time period possible. And then we will continue to adjust our allocations between our other priority populations that we are taking care of with specific state resources and what is left for them to take care of as part of that federal partnership. So I think that was to answer your first question. And then you're asking about how quickly we're going to get vaccine out to everybody, essentially. And I just want to make sure and remind everybody of the logistical challenges of doing this vaccine program. So there's a lot of factors that come into play that are going to go into the answer to a question like that. And I think we need to always keep in mind that it has to do with the supply that's coming into the state. That's obviously a limiting factor that we don't have direct control over. There's the factor of throughput, our ability to get vaccine into the public quickly. With some of the restrictions on this particular vaccine, or at least challenges with it in the way of a 30-minute wait period, potentially after somebody gets a vaccine, things like that will impact our throughput. And what I mean by that is where if we were just doing a flu clinic, we could process thousands of people in a single location in a single day with a drive-through model that we've been doing for years. But those models did not include a potential wait period, an observation period following the vaccination. So those things greatly reduce our throughput, and that will impact how quickly we can get vaccine into people. That is the reason we want to make sure and maximize the medical system around the state. We want to get the primary care providers signed up as pandemic providers. We want to get health systems signed up, and we want to use every interface possible between a healthcare professional and the public. We want to use those interfaces to get vaccine into people so that when the quantity or the supply is answered by the federal government, we know what we get in, that we can turn around and quickly give it to individuals. The other factor I would remind you of is uptake. We need people to take the vaccine and agree to take the vaccine. So uptake will also determine how quickly we get through these priority groups as well. We're not going to sit on a priority group and wait for people to, for everybody within that group to come and get vaccinated. If we're seeing resistance to the vaccine, we're going to move to the next groups. We want to get this into people as quickly as possible.
Okay.
Hopefully that helps answer.
Yeah, no, I greatly appreciate the clarification on the first shipment, Keith, and I am very cognizant of what you were saying, the monitoring, and I did a story with Ellen Nimetallo yesterday, her explaining about, the safeguards in place, which is ultimately helps people feel reassured, and like you were saying, that monitoring period. So is the best thing for us to share with all of our viewers, readers, listeners, is that it's fluid and we don't know an exact time period in terms of next year when the goal would be to have everybody? I mean, what is the best thing for us to say? Just that it's fluid?
Yes.
I think that's absolutely true. It's fluid, and we would also ask the public to, recognize that it needs to be fluid, and we need patience from the public. That's why we need them to continue the other precautions to prevent transmission of COVID. So if they can be patient with us and understand that it's fluid, but that we are taking every step possible to try to eliminate bottlenecks and maximize our efficiency and capacity to get the vaccine out, I think it will be a smoother process for all of us.
Okay, I greatly appreciate the extra information. Thanks very much.
Thanks, Tiffany. I know we're kind of running up on time. I want to make sure, I don't know if Dr. Frye, everybody else, what your timeline looks like. Maybe give at least some of the media outlets who haven't asked a question yet an opportunity. Sharda, Erika with Fox, are you on?
Yeah, I'll let Erika go first. I just had a quick question when it comes to the general population and really everyone getting the vaccine. How do you plan to track who got which vaccine, Pfizer, Moderna in the first round? And then to remind them to get the second dose, you have to imagine some people could forget when to go back for that second dose and then which vaccine they even got the first time. And what happens if they don't get the second dose within that 3-week time frame?
So those are great questions. I would say that's been a serious consideration in our planning. In order to kind of mitigate the complication from that, first of all, we want to try to be consistent with the manufacturer of the vaccine that we give to certain areas. In other words, we want to try to, instead of mixing up the vaccines that may go to a particular healthcare facility or something, we want to try to be as consistent as possible so that they deal with one vaccine instead of multiple vaccines. Now, I'm not saying we can absolutely stick to that, but that's what we're going to attempt to do. And then additionally, we're going to use our Oklahoma State Immunization Information System, or OSIS system, that tracks the individual's vaccine, including the dose and the manufacturer. So we will have that information, and all our pandemic providers will be signed up into that system. So they will have access to that information to verify it. And then we're using a reminder system to send notifications to people to remind them of when their second dose is due. So it's a combination of efforts to go in and try to mitigate that complication.
Okay, thank you.
And Erika, just to add that the federal government is also going to try to send notifications as well, so people might receive more than one reminding them, when it's time and where to go.
Awesome, thank you very much.
Sharda, did you have a question too?
Yeah, so my question was, Commissioner Frye, he mentioned that everybody wants to know when they will be able to get the dose. We know that the doses are going to be here December 16th, but is that the specific date when the first phase of people who are high risk, when they will get it, or is that another date?
Well, we don't know the exact date of arrival yet. We think it's going to be the 16th, but we are planning to start as soon as it arrives to start giving people the vaccination. So they should be the group in phase 1 should be planning on getting it that week of December.
I would also add to that, if I could, this is Keith. Those particular groups in healthcare facilities, they are already working on rosters and such for that first phase of the vaccine. So there's a lot of detailed planning that is going on at the organizational level for that.
Yes, I'd like to echo that. At our organization, or at least at mine, there is a huge amount of background or behind the scenes work to get this set up. And as you can imagine, it's difficult because the information changes daily, twice daily, 3 times daily. And so, but I'm sure every organization in the state is doing this and really trying hard to get the vaccine out to their workers just as soon as possible.
Thank you so much. I appreciate it.
Tevis, are you still on with News 9?
Yes, hi, thank you. Governor Stitt's goal is to have students and teachers back in the classroom by next semester. Was there any conversation to why this group is in the 3rd phase of distribution? And also, what's the best idea of when they will actually get the vaccination?
Yes, well, we've had a lot of discussion about all these different groups and including the teachers. And so again, I just want everybody to understand that first of all, what we had an outside board work on this, and when they came out with these, it did match up with what the federal recommendations were as well. But these are they're gray lines in here. I mean, we may be doing some people from phase 1 and phase 2 at the same time. So it's just more to come on that. And as Dr. Drevets said, it changes sometimes 2 or 3 times a day. So, you know, it's a very fluid plan that we are editing as information changes.
Right. In addition to what Dr. Frye said, you know, everybody wants students to get back in the classroom, no question about it. The committee that worked on the distribution used documents not only from the federal government, from the Centers for Disease Control, but also from the National Academies of Science and from the Advisory Committee on Immunization Practices. So there were several very well thought through documents that we could look at when that was being done. And this was all done on a risk-based approach. And so you really want to get the vaccine out to folks who are at the highest risk of having a bad outcome. And so that, and students by and large are not going to have a bad outcome, so to speak, with this virus. So we anticipate getting it out to everybody as soon as possible. But we really had to think through this on a risk-based approach.
We just have a few more minutes left. Chase, Channel 4, are you still on?
My questions were answered. I'm good.
Okay. Kassie?
Yes, thank you. I just had a quick question. I was just curious if we know which foundation donated those storage units for the coal storage we were talking about earlier.
Keith, did they have any issues with letting people know?
I don't think so. It was, I'll go ahead and say it was the Noble Foundation.
Okay, thank you.
Anybody else have any questions? I'll just open it up. Otherwise.
Catherine with State Impact. I was wondering if phase 3 would include anyone who worked in child protective services or child welfare services, anything like that within DHS or any other services treating children.
Yes, I would say that those would definitely be included with our critical infrastructure groups.
Thank you.
This is Ken with the AP. Follow up on the storage facilities. You mentioned 11 were donated. How many total does the state have storage facilities?
So I don't have an exact answer on the numbers we have, because what we've been doing is really kind of keeping an inventory, and a lot of that is done through partnerships, not necessarily through just state ownership. So, for example, you know, we got these 11 freezers. We didn't start out in our county health department to have these ultra cold freezers, because we didn't have a reason to have those before on our normal operations. So we've added these to our inventory. I think we may have had one other one, but we've been, as part of the planning, we've been reaching out to partners, health facilities around the state to see what they have in the way of freezer capacity. And it's another example of, this is not a one agency response. This is not a OSDH only response. This is a statewide partnership response. So I don't have the exact numbers. There are a lot of them around the state. Actually, when you start to dig into it, the quantity that they can hold, though, varies considerably.
Rick Maranon, Fox 23. Quick follow-up question to Dr. Drevets. With everything you know about COVID and what you've studied with the effectiveness of the vaccine, do you think we're going to have to take this over and over again for the rest of our lives like a flu shot? Or is it still too early to tell just how effective this thing's going to be when it comes to lifelong immunity?
So that's a great question. And indeed, you know, we're walking through this right now, so we'll find out eventually. My opinion is we will not be taking this every year, and that we will have some degree of lasting immunity. In several of the vaccines studies that I've looked at, the vaccines actually induce stronger immunity than the natural infection. And that in part has to do with the way the vaccine's made, and in part has to do with the fact that many viruses and other germs that infect us have ways to counteract the immune system and sort of disguise and obfuscate, the immune response, or, what they're doing. So by using these particular particle vaccines, you can make a very targeted immune response to the part of the germ that prevents infection. So I'm actually much more optimistic than I was 6 months ago about not having to be vaccinated for COVID-19 every year. And I think, well, obviously I could be wrong on that, and we're all going to find out.
This is Kassie McClung with the Frontier again. I just have a quick question. Is it correct that pregnant women and mothers who are breastfeeding won't be vaccinated in this first wave, just as we're awaiting more safety data?
So we're also awaiting the final documents from the FDA in terms of the groups that they're approving it for. It is true that pregnant women and those who are breastfeeding were not included in the clinical trials. And so there are no data studied in this group. I do believe some of the vaccine participants in the Pfizer trial did become pregnant. And the recommendations in the United Kingdom, when they rolled out the Pfizer product, they excluded women who were pregnant and women who were breastfeeding. So my guess is that those groups are also going to be excluded from this vaccine in the US, but the FDA will let us know for sure. The other side of that coin is, fortunately, pregnant women, both the woman and the infant, are at very low risk of bad outcomes with COVID-19. So that's actually a good thing. And so I don't think we're not excluding a high risk group, so to speak. There's just very little data in this group, and we'll see.
Thank you. Dr. Drevets, along those lines, to that point, to Kassie's point, I know that I've had questions from viewers concerned about any potential fertility issues, and I know that Pfizer has openly said that they're not sure yet, obviously, because we don't have studies as we have with other vaccines for years at this point, obviously due to the time and the need to quickly get people vaccinated. So would you say that it is safest to say that we don't really know how that could affect women's fertility going forward? I mean, especially long term at this point?
I think the honest answer is we don't know about women or men on either side of that coin. Again, my bias is that there was nothing in the data that I saw that was reported to the FDA that would have made me think that fertility was going to be an issue. There were no, there wasn't, orchitis wasn't, reported. And so, but we'll see. Other vaccines do not seem to have issues with fertility. And I guess I just wouldn't expect issues with either male or female fertility with this one either. But again, we are walking through this for the first time, and we'll see.
I appreciate it. Thank you so much, Dr. Drevets.
Yeah, we'll go ahead and end it there. I know we're at time, so I appreciate everybody's time, and we'll keep updating you definitely next week as well. Thank you.
This was super helpful. Thanks, everybody.
Thank you.
Thank you so much.
Thank you.